Welcome to this edition of AFMC
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Jennifer Connor, and she is the Vice President of Rural Health for the American Heart Association in the Southwest region. Jennifer, thank you for being here.
Yeah, it's my pleasure to be with you today.
So tell us about the rural health strategies that the American Heart Association is working on.
Yeah, gladly. So here at the AHA, we strive to really meet people where they are. And we realize that the social determinants of health or social drivers of health really does determine a lot of our health outcomes. So back in 2020, funny, right before the pandemic, even more timely, the AHA published a presidential advisory specifically for rural health. And in that report highlighted many opportunities for improvement, including some of our top priorities that we're focused on now, like increasing access to care, improving healthcare quality, and addressing risk factors. So to support that, our rural strategies range from creating a healthcare workforce through like our HeartCore program to conducting hands-only CPR demonstrations to establishing what we call SMBP or self-measured blood pressure programs. To implementing our evidence-based Get With The Guidelines as part of our Rural Accelerator program. So we really do try to do things like integrate nutrition screenings, like at our local hospitals, our local clinics, our local food banks. So really just drawing all the things that we need to improve health. So specifically, all of that really community impact work relates to the research that we do here at AHA. And we are in the most rural communities working to really understand, I would say, both the assets and the challenges in our rural spaces. And so we look for specific ways to build on those local assets. And that could be a library, a senior center, Boys and Girls Club. And then we implement efforts that maximize, right, that asset in the community. And, or perhaps we just leverage, what is already existing in the community, realizing that that builds sustainability over time. So this community engaged approach has really influenced our research efforts, and you may be familiar with what we call our HERN, our Health Equity Research Network. We have one specifically for rural, which focuses on practical and sustainable innovations to address the uniqueness of our rural communities. So we are definitely committed to supporting research that directly addresses individual factors, social determinants, and the healthcare delivery spaces in our most rural areas.
Agriculture is a part of the strategy. It seems kind of funny, like agriculture and rodeo, but they're both relevant. Tell me more about that.
Yeah, absolutely. So as I assumed this position, I should say I'm from the Arkansas and Mississippi Delta. And we know that in every small town, you've got your festivals, your rodeos, your extension offices, all of those things. And we know that agriculture is, for most of our rural communities, our number one industry. And so to think about hypertension management, CPR, all the things that we do here at the Heart Association, we have to include the agricultural sector. And so we've really launched a strategy around both addressing the health and wellness of our farmers and ranchers, but also capitalizing on rodeos and festivals in our small communities to teach CPR. So we know most rural residents are at least 20 to 30 minutes from an ambulance. Most of our farms and farm workers are in a can be a highly dangerous situation. So knowing CPR can be life-saving. But we also know that our farmers and ranchers are aging, and they also experience those chronic disease that most of our population do. So you may be at risk for a heart attack, a stroke, as much as you are that tractor rollover. So knowing CPR is certainly important. And so we recently spent 10 days at the Fort Worth Stock Show and Rodeo, one of the largest in our area. And we did a series of mass CPR demonstrations, but we also had an expo booth where we talked a lot about the risk factors, diet and exercise. As we think about agriculture over time, it really has become industrialized. We have now GPS and tractors that literally drive themselves. And so we do have to think that even though agriculture is very labor intensive, there is still need for that, physical activity to get that heart rate up. So we're very excited about this initiative. We know that, again, agriculture is such a cornerstone, and rodeo, Western lifestyle, can be such a cornerstone to rural. And so, again, meeting people where they are means us integrating our programming into those spaces and places.
And you mentioned Texas. This also filters into Arkansas, right?
Oh, absolutely. So I'm very excited. I've been working with the University of Arkansas Cooperative Extension Service, of course, a very trusted source for ag, as well as the Arkansas Department of Agriculture and the AgriSafe Network. So I was very excited this spring that I got to attend the Arkansas Grown Conference in Hot Springs. I was a keynote speaker there, just talking again about how we have this chronic disease burden among our farmers and ranchers. And I got to do CPR demonstrations and, again, serve as a keynote where for everyone, we got to practice our hands-only CPR skills. Also in Arkansas, we have 3 rodeo teams at the college level. So UAM, Arkansas Tech, and SAU. And we have 1 ranch horse team at the University of Arkansas. So we're definitely looking at ways that we can partner with our next generation of lifesavers, teaching that skill both at our elementary school through like our Kids Heart Challenge, but then making sure that it's like a fire drill. We just keep practicing our CPR skills throughout. And very exciting in this space, too, is there's lots of technology and advancements that are happening both in other countries and in pilot tests here in the United States about drone delivery of AED to our farms and our most rural areas. So as you know, in agriculture, drones are already being used for precision spraying. So we're very excited about what the future can hold for technology in the space of agriculture and chronic disease management.
So interesting. And maternal health also plays a role in this, health initiatives that are that ties directly into maternal health. How does that work?
Yeah. So, when you look at the statistics for, and the outcomes in rural, maternal and child health is certainly up there as an important factor. We do know we have critical access hospitals that are losing their OB-GYN services or delivery services. I think there's studies now that show on average some women are driving more than an hour for delivery or for prenatal services. So one of the specific things that the Heart Association is looking at is just like the general population, we know that managing your blood pressure during pregnancy is super important for both the mother and the child. And the CDC recently actually just put out a new toolkit that looks at how we can work with clinicians and community members to help our pregnant moms along with that hypertension management during pregnancy. But also we want to look at postpartum. So we have states, for example, that have extended their Medicaid coverage, 12 months postpartum, realizing that, blood pressure keeps going. If you have blood pressure problems during pregnancy, it doesn't just stop when the baby comes. So there's still that need for that hypertension management along the lifespan of that mom. So it's certainly something that is very important to us. We know that nutrition is a big piece of that as well. So not only for pregnancy in terms of nutrition for the development of the baby, but just, again, hypertension management. So it kind of all goes together. I know the state of Arkansas recently launched, some initiatives around maternal and child health. So it's something that, if we can't control the systems in terms of OB-GYN and services and labor and delivery, how can we at least work in that system to provide the best possible outcomes for that mom?
And food security, you mentioned nutrition, but food security is also a part of it, especially within rural communities. How does that kind of tie into this initiative?
Yeah, as much as we talk about, sustaining our critical access hospitals, we also need to sustain our grocery stores or look at innovative ways to have food delivery models. So this is a very exciting space for us. As I mentioned a little bit earlier, just thinking about a patient walking into a clinic, and as much as we say, hey, what's your, your primary concern today? What if we also said, and do you have, food security? Is food an issue for you? So we've worked really hard with, again, clinics and hospitals and local food banks to institute these nutrition security protocols, and then working on the referral. So what are those options? So food security is definitely a piece and part of our holistic health that we need to think about. But, also we just mentioned agriculture. So what are the innovative ways that we can look, especially in Arkansas and some other areas, row crop or cattle or beef are the main industries, but we need to look at, innovative ways to have that fresh produce available. We have one great example in Northwest Arkansas where we are working with a clinic, and we have senior hypertensive patients that we're doing a food delivery box. So getting those fresh fruits and vegetables, realizing that transportation might be an issue, independence or mobility to get out might be an issue. So working hand in hand with those clinical community linkages to make sure that food access is something that we're not struggling with, especially in our senior population.
And telemedicine, telehealth, the connection to broadband, all of that also connects to this initiative too?
Absolutely. So we know in most of our rural areas, broadband can be a really big issue. It's something as a nation that we will be working on for a good bit of time. But we do know that perhaps there's a local library just 6 or 7 minutes up the road in the city center. And when I say city center, that may be still a population of town of only 2,000, but that's the strongest signal. So we have been working on setting up what we call community health hubs or community hubs. So those senior centers that I mentioned earlier, those libraries that are assets, those extension offices that are assets, we've been working to help set up telemedicine rooms, telehealth rooms in those spaces. They're trusted, they're used, they're often open and have strong signals. And so much like on our Get With the Guidelines, we want to make sure that our providers, our physicians, our healthcare workers know the latest and greatest technology and the latest and greatest guidelines. But we also want to make sure those access points are there on the consumer side. Also, working with those librarians, we have a really strong one in Texas who is looking at digital literacy. So, it's not just enough to have the computer sitting there, but how equipped, do the staffing around that fill and helping with that digital literacy. How can we increase not only health literacy, but digital literacy so both of those go together and create the best possible patient outcome?
And since this is the Southwest region, how does Arkansas compare to other states? You mentioned Texas. Is Arkansas on par, in comparison to the others?
Yeah, absolutely. I think, as I do this job across 6 states, and I have Wyoming, Colorado, New Mexico, Oklahoma, Arkansas, and Texas, there's definitely some generalizability across this region, whether we're talking about the Arkansas, Mississippi Delta, the Rio Grande Valley, the frontier of Wyoming, the eastern slopes of Colorado. I think rural communities really do struggle in some ways with some things. But as I mentioned, they have lots of assets, lots of community cohesion. And so how can you build on that? So I would say, Arkansas is up there with the rest of really trying to take this more asset-based approach and really say, okay, how can we work together? Cooperative extension is doing this. Libraries can offer that. The hospital is doing X, Y, and Z. And so really having this collaborative, as I mentioned, community clinical model. And I would say, I previously worked on, a Million Hearts campaign in Arkansas. This was, 6, 8, 10 years ago. And we have those same sites and those same physicians that are now have a HeartCore member, for example. So it's great to see the foundations that we've laid around cardiovascular health, 10 years ago, continue on and really, again, try to think about those assets in those communities instead of kind of going the other way around with saying, what are the gaps, but what are the assets? So I would say, there's some innovative models in Arkansas. I just mentioned, the food delivery, Uber Eats, if you will, but for medical purposes. DoorDash, if you will, but for hypertensive control. So yeah, I mean, I think I would say Arkansas, the willingness to try, the willingness to change, definitely puts them on par with some of the other states that I work with. And I love to see the innovation. So, for example, I've already connected librarians, in this town with some of my librarians in Wyoming and their Center on Aging. And so it's great to be able to see also through our Rural Health Summit. So every year we have a Rural Health Summit. That's where we bring all of the innovators and leaders and community members from all 6 states to come together. And it's great to see that exchange, right? And that willingness to say, well, all we can do is try. So absolutely, I'd say it's been open arms to say, we know we need to address health in Arkansas, and everybody willing to be a player and have a piece of that puzzle.
And how do social determinants of health really play into this? They play a big role, right?
Yeah, a very big role. We know that, studies have shown that roughly, 10% of what happens inside the clinic walls actually has the, the health outcome impact, where the other 90% of your life, where you live, work, play, all of those things matter. And so I think, we've known for a while health equity, social determinants of health, now called social drivers of health, have been super important. What I'm very excited about is the integration of those into clinical care, right? The integration of those into community-based organizations. So as I mentioned earlier, to have a food pantry say, yeah, we need to have a screener for social determinants of health. And it's not just to provide a food service, right? We have clinicians that now through their EMR, their health record are saying, do you smoke? Yes, no. Do you exercise? And then they're saying, do you have transportation? Do you have housing? Do you have food? That's been a shift that we've seen, in the last part of, 5 to 10 years. And so hopefully as we integrate that into our everyday language, and we, like I said, can address how much they actually affect our health outcomes, that we can start to see a shift in the way we practice medicine, in the way that we operate as a nonprofit, in the way that we provide our social services as well. So as a practitioner, it's very exciting for me. When I get the call that says, hey, Dr. Connor, we made a referral. Like, thank you for the work that you do, because, that's not something that we would have done, 3 or 4 years ago. And so our CI staff are just doing amazing work. Our community impact staff are doing amazing work to think outside the box of who we need to work with, so that this becomes part of an integrated service or practice skill that we all are doing.
So how can a healthcare provider, community partner get involved? How can they? Are you still looking for ways for them to get involved?
Always. As I like to say, again, everybody has a piece of this puzzle. Whether you are, as I mentioned, a librarian, a rodeo coach, a farmer, rancher, a healthcare provider, a community health worker. The old saying is, we have to hear things, 2 or 3 times, up to 12 times, for it to become a behavior. And so I think, if we're working with our faith-based organizations and you're hearing it on Sunday morning or Wednesday afternoon, and then you go to your healthcare provider and you hear it, and then you go to the John Deere dealership and you hear it as well. I'm very excited about some work that I'm doing with a 21st Century Ag. It's a John Deere dealership of 26 locations across Colorado, Nebraska, and Wyoming. They just put AEDs in all of their stores. Very exciting that they are now realizing that, cardiovascular health all the way back to the need for an AED is important. So I say all that to say, again, there is a role for everyone. And if you want to get interested, we have a rural health section on our the Heart Association website, and you can visit that and click on Contact Us, and I'll be glad to share my information. But yes, 4-H, in fact, today, as we speak in Chico County, we placed 2 kids with the Drew County and Chico County Extension Office, and we're having a hands-only CPR demonstration. So again, 4-H, no, young, old, it doesn't matter. You're part of the equation to help solve some of these rural health problems.
Well, thank you. Thank you so much for talking about this program and for what you're doing for Arkansans from every corner of the state. It sounds like everyone can get involved.
Everyone.
Well, thanks so much, Jennifer. I appreciate you coming on today. And that's it for this episode of AFMC TV. Thanks for watching and have a great day.